Good afternoon, everyone, and I think we'll make a start. If anybody else is joining, they can pick up as they enter into the room. I would like to take the opportunity to welcome everybody to the first webinar that we are holding as an information event for the Digital Health Uptake Twinning scheme, which was launched last week. The purpose of today is to provide you with some information on the DHU project itself. And Strahil Briha from Empirica will actually present on that. And this will be followed by a short presentation from Mirella Negrian from the European Commission DG Connect. And Mirella is a new policy officer that has joined into DG Connect, so a very big welcome to her. But Mirella will focus on the role of Twinnings, or the impact that Twinnings can have on key European Commission priorities. And after that, we'll have an introduction to the Digital Health Uptake call for Twinnings. We'll explain the process and the scope of that for you. And then we will finish with a question and answer session, so as hopefully we can address any of the questions or concerns or issues that you may have on the Twinning scheme as it commences. So without further ado, and maybe just before I introduce Strahil, I will mention that the event today is being recorded and will be available on the DHU website. We will also, on the RSCN website, provide a link to the webinar as well, and we will upload the webinar to the Futurium platform as well. So it should be accessible to everyone. We will also have a second webinar on the 18th of July for anyone that is unable to make today's event. So we'll be communicating more on that over the next week or two. So without further delay, I'd like to welcome Strahil Birov from Empirica. Strahil, floor is yours.
Thank you very much, John, and welcome to everyone. I will briefly introduce the DHU project. We call it DHU internally, Digital Health Uptake, because the Twinnings are organized as part of that project. It is a European funded project under the Digital Europe program, and it has been running for a while now. It will run for 2 years in total, and you can see here that it's implemented by a consortium of partners led by Empirica. We are coordinating, but also with the help of many other different partners. I see also some are online today with us from ETE, the IHD, European Institute for Innovation Through Health Data, Digital Europe, ECH Alliance, RSCN, and F6S. And the overarching goal of this project is to facilitate the alignment, strengthening, and coordination of policy, strategies, instruments, and activities regarding the uptake of digital health solutions and services in Europe, because we know that there are quite good solutions out there, but not all of them are taken up and scaled up. And that's why we need to analyze what can be done to foster this. This can be broken down into 3 different areas that we're looking into, 3 big dimensions. The first one is actually, can we monitor and analyze the current uptake of solutions in regions, member states, and associated countries? The second one focuses on creating an environment of cooperation and stakeholder engagement so that we work together on addressing challenges and gathering ideas related to the upscaling and upscaling of those solutions. And the third area in which also the Twinnings can be positioned is about strengthening capacity building for implementation and uptake by identifying relevant tools, methods, solutions that can be upscaled, providing guidelines, and stimulating mutual learning and transferring of different practices and experiences. So the first area, the first objective that we talk about, monitoring and analysis, we have been working to set up a so-called DHU radar. So it is a radar for digital health innovations, and it allows us to understand what are the solutions out there that might be of interest for scaling up, but not just for scaling up, also as a general database for stakeholders to know at any given point in time what are the solutions in Europe currently that address a specific topic. It can be a disease topic, it can be something else, but it has to relate to digital health. You can visit the DigitalHealthUptake EU/radar website to see more information about that. But the radar is basically comprising several different components. One of them is a repository, so a database where you can actually search for different solutions. You can filter those results, search for example, only mature solutions, search for a specific condition. There is a search bar for this. Based on the submissions that we are continuously now receiving, in certain points of the project, we'll do analysis based on them, and this analysis will help us with further activities planned in the project that we'll talk about in a second. And many of those submissions, be it digital solutions, practices, tools and methodologies, we call them, and as an overarching, we call them practices in general. They can be highlighted on social media and through our website. So even though this is about Twinnings, I would still encourage you to visit that Radar repository. It is an important piece of that project of ours because you can put your solution and your innovation on the radar and very easily reference to it when you talk to other stakeholders about it. And it will also help us with our further work related, for example, to knowledge building and community building. It's very easy to do. You just need to create a very brief profile, and we've picked different fields for your practice so that it's not taking too long of a time. Usually it takes less than 10 minutes for you to register a practice on that radar. And of course, you can spend a bit more time completing further questions, but the core questions are done in a way that it allows you to very quickly submit a practice. And I am sure that the audience today represent participants who actually have practices or want to adopt a practice and would like to go to the radar and see what is out there. This can also help you to matchmake and to find suitable solutions out there that you can collaborate with. The second part of the project, or the second goal also, was about fostering cooperation, linking existing and creating new digital health knowledge in Europe. This activity is led by the IHD, the European Institute for Innovation Through Health Data, and roughly we are looking at what are challenges in upscaling, identifying those challenges and topics, and based on those topics we want to create briefings where we collect information about the current status quo, about relevant solutions from the radar, for example, that address these challenges, experiences of champions and other stakeholders who already have some good ideas about how this can be overcome. And this culminates in a dedicated workshop per topic in which we want to explore further, consolidate results, and create policy briefs that will help us then advance and address this challenge more efficiently. The events itself will also include a matchmaking aspect. So you see here that these events are currently in planning, and the Twinnings could deliver some nice insights from your work once we kickstart the Twinnings and feed into the knowledge community aspect of the project. Last but not least, the third big dimension is also where the Twinnings are. We call Accelerator, the DHU Accelerator, and it's our implementation scaling up. This area is led by Ete, and it deals with several different aspects. One of them is for you to upscale a solution, maybe you need specific supporting tools and methodologies. So we are looking into what are the typical tools and methodologies that one would use to facilitate that aspect. Another part is, of course, the twinning activities. And based on the tools, we also want in the future to offer technical assistance and training for using such tools. This is an upcoming activity in several months. So be on the lookout for it by visiting the website and subscribing to our newsletter under DigitalHealthUptake.eu/get-involved. This was the overview I wanted to give. So obviously there's a lot of different topics that we'll be focusing on in the upscale of digital solutions, and the Twinning call itself has plenty of suggestions and ideas for topics that we want to address. But I think now we can see from the Commission perspective what are topics and areas of priorities.
Thanks very much, Strahil. Mirella, I'll pass to you now at this stage.
Hi.
You're very welcome.
Yeah, you can hear me, I suppose. Yes.
Yes.
Hi, welcome everybody. Thank you for inviting me to this workshop. Sorry. Yes, I will say a few words about the Twinnings in the context of the key European Commission priorities. So I'm Mirela Negran. I'm working in the e-health, well-being and aging in DG Connect unit. You may be familiar with us already. We've involved in quite a lot of things. Thank you. Next slide. Okay, so our work here in our unit is basically based on the Digital Health and Care Commission communication from 2018, number 233. We are working in three pillars. First one is the secure access and exchange of health data. Another one is the health data pool for research and personalized medicine, and the one that let's say we can categorize this project in is the digital tools and data for citizen empowerment and person-centered healthcare. So this is our work. Been for a few years and will continue. I will say a little bit more about this in a future slide. Next, please. Yes, about the priorities. The one of the most important priority of this commission led by Ursula von der Leyen is to make Europe fit for the digital age by empowering people with a new generation of technologies. The European Commission is working on a digital transformation that will benefit everyone. Digital solutions that put people first will open up new opportunities for businesses, encourage the development of trustworthy technology, foster an open and democratic society, enable a vibrant and suitable economy, and help fight climate change and achieve the green transition. Thank you. The Commission is determined to make the current 10 years Europe's digital decade through accelerating Europe's digital transformation by 2030. The path to the digital decade is the Commission's proposal to set up a governance framework to ensure Europe reaches its 2030 digital decade objectives. As you see here, you have digital skills where there is still a lot of work as Europe it's not where it should be, lacking a little bit behind. So the target is to have 80% of adults with basic digital skills by 2030. Also, we have targets in digital infrastructure, in the digital transformation of businesses, in the digitalization of public services. Yes, thank you. Digital technology and use of data are the future. The biggest challenge to overcome is the integration of technologies and data into our daily lives and into the health and care delivery process to create positive impacts in citizen lives. So this is how Twinnings can help us do this. They are a very important part. We are not only supporting cities, regions, and countries to achieve successful digital implementation, but we are supporting them to share their experience and knowledge with others who want to adopt successful digital practices. Twinnings, though, enables the uptake of successful digital solutions and it strengthens the scaling up of innovation in the health and care sector. Here are a few European projects that are implementing Twinnings that were a very famous one. A project we had in the past is the European Innovation Partnership on Active and Healthy Aging, which managed several Twinnings waves between reference sites. More than 30 pairs of twins involving more than 60 regional organizations received awards. You have also Info-Raha project, who funded 10 successful Twinnings application in 21-22. Yes, the call was had a deadline in December 21, and so the Twinnings were running in 22. I have also other projects like Scirocco, Scale-Aha, sorry, Gatekeeper, and Digital Health Europe, who funded 21 successful Twinnings applications. Thank you. Next slide. Yes, so yeah, Digital Health Europe. The idea is here to don't reinvent the wheel, transfer of innovative practices and knowledge sharing. So there were 21 Twinnings supported by 24 originators and 55 adopters were able to implement digital health and care solutions. So this is kind of inspirational projects for you. If you want to find more information, please you can Google them and find more on their work. Thank you. Next part. Okay, as I said before, I will just share a few words about our work, let's say in the currently and in the very near future. In work in the Health in Digital Europe Work Program 23-24. So this calls Genome of Europe and Federated EU Infrastructure for ECU data. They are launched. The deadline is in September. If you are also interested to be part of them, please apply. Another one that will be launched soon will be patients' access to data. Will be launched this year, and you will apply. Very soon also we'll have a procurement called for a platform for advanced virtual human twins models. Apart from them, for these areas, we are also working a lot in the cancer area, combating cancer plan. If you heard about it, and there are lots of projects currently ongoing. Okay, thank you. Okay, a few words about financial support to third parties, but you'll have more information from DHU on their website. If you want to know about more about the rules, you can go to the guidance and manuals on the funding and tender portals. And you have there also detailed guidance on financial support to third parties in Article 6.2d of the annotated grant agreement, which is publicly available for granting authorities and beneficiaries. And here there are a few things that you should take into account. So the financial support for third parties can take many forms. One of these is what you have here, a cascade grant for Twinnings, but can also be prizes, support and assistance to local NGOs, allowances, scholarships, yes, different forms. The beneficiary must promote the action and give visibility to the EU funding involved, but must not present the grant or prizes given as given directly by the European Commission or any other EU granting authority. Okay. There are also eligibility conditions. Okay, that's we're gonna. Okay, thank you. There are also eligibility conditions that you should take into account. Okay, thank you. My time expired already. Thanks. You can search for more information there.
Thank you very much, Mirella. So where we are at the minute then is that you've had an overview of what we're wanting to achieve from the Digital Health Uptake project, and importantly, you also are aware of the Commission's view on the impact that Twinnings can have, but also in terms of some of the digital strategies coming forward into the future and the whole positioning of it all. Next slide, Starahil, please. Next one, please. So where I want to take you now to is I want to give you an overview of the Twinnings scheme. Looking at those colleagues that have been able to join us today, many of you probably have been involved on Twinnings in the past, so you may be familiar with what a twinning is, but I think it's important for the benefit of anyone that hasn't been involved on a twinning scheme to actually sort of put this into the context of the third priority for the Digital Health Uptake programme, which is to look at accelerating the scaling up of digital health and care solutions. And it's in that context that the Twinnings actually sit. So we should actually see Twinnings as the opportunity to take a good practice or an evidence-based digital solution that has been operating in another region or country that we are interested in adopting it into our own region or our own country. So in that context, it's about being aware of what is out there, and we'll come to that later on in terms of where you might be able to identify some of these evidence-based digital solutions that you may want to twin with. But in terms of the twinning scheme itself, it very much is about that supporting the scaling up of digital innovation solutions. And to support regions in doing that, we're making funding available through the project Cascade funding, which will enable the transfer of those solutions from one European region to another European region. And within the twinning context, we have two types of actor. We have got the originator, and the originator will be the organization or the region that has developed the digital solution, that has an evidence base to support it, and can actually demonstrate that they have taken it from a testbed environment and have actually started scaling it up within their region or within their country. And that will be the originator. The adopter will be another region or country that is interested in that solution, and they wish to consider bringing it into their own region, either to implement the solution as is, or to take the learning from a twinning and look to adapt whatever that solution is, maybe to make it more applicable to their own circumstances in their own region. So we've got two main actors here. One is the originator, the other is the adopter. Now, in saying adopter, there could be multiple adopters because we could have 2, 3, 4 regions that are interested in the same solution. So it would be possible to have the twinning on that one-to-many basis. So the twinning would be a one-to-one originator to adopter, or one-to-many, one originator to many adopters. And whenever we look at what's involved exactly in a twinning, and for those that have not participated in previous twinnings, we're looking at the twinnings will support the hosting of meetings, showcasing, being able to demonstrate the solution operating in the originator area, looking at the travelling and accommodation expenses that might be incurred whenever the adopter region is visiting the originator region, or indeed the originator is following up with a meeting with the adopter, maybe to look at some of the issues in terms of what might need to be done in terms of implementation or the adaptation of the solution to meet the adopter region's own circumstances. Twinnings can vary depending on what the content of the twinning is and what you're looking to achieve from it. Generally, they last between 3 to 9 months. So we have sort of built in that time scale of up towards 9 months on this, because what we want to see from these twinnings is not just a transfer of learning and knowledge. We actually would like to see the adopter region or regions considering, what are the issues that need to be addressed in implementing that evidence-based digital solution into their own region. So some preparatory work that would pave the way for the adoption of the solution, either during the DHU project period or after it. Next slide, please. So what we're looking then is that the digital solutions will provide that digital know-how that can be transferred through the twinning activities to the adopter region. And when we're looking at, what is it we're talking about in the twinning, it's about evidence-based products, services, processes, methodologies, strategies, or indeed the business models that have been scaled up by the twinning originator's own country or region. So it's looking for that's not just about there's the solution, but what may be needed to happen in terms of implementing that solution, and whether there were any policies or strategies or anything else that needed to be amended or changed. And importantly, whenever we are sort of looking at the transfer of the solution from one region to another, it's important that we actually understand if there were any barriers to the implementation of the solution in the originator site, because the learning from that can actually help an adopter in identifying what are the key issues that they need to be thinking about, particularly if they're looking at developing some sort of an implementation or an action plan in order to bring the solution into their own region. So it's important that we actually focus on those barriers or indeed the enablers to it as well. And the topics that are taken forward within the twinning, they must be based on the digital technologies. And this is the DHU as part of the Digital Europe program. It's about the accelerating, the scaling up, the transfer, the adoption of digital health and care technologies from one region to another across Europe. So we must be focusing on the digital technologies and health and care for it. and they should be innovative and not have been used by the adopting region before the twinning actually takes place. So this has to be something new that is coming from an originator region into an adopter region. Next slide, please, Strahil. So to support this, and this is probably the important part for many people, is the budget that would be available to support those types of twinning activities. We have sort of an overall budget of just under €100,000 for the twinnings. And what we're proposing is that we would have 12 twinnings that would be selected through the process, and that each twinning would receive a maximum of €8,000. And that funding would be used to cover some of the costs that I had identified before in terms of travel, accommodation, room hire, translation services, etc., etc. The funding will be made available through the project, and it is provided to the twinning partners in the form of a grant as financial support to third parties. And Mirella explained what the financial support to third parties was. So that's the process that we'll be adopting for this. And whilst the budget is being provided through the Digital Europe programme from the EU is not part of the award process for evaluating and assessing the types of twinnings going forward. Next slide, please. So when we look at the possible topics, what sort of topics should you be considering? I'm sure many of the regions represented here today may already have evidence-based digital technology solutions in a lot of these areas. If they don't, you may know another region that has developed solutions in these areas that you are particularly interested in, because you may want to make contact with them and see whether you can form a twinning partnership with them for it. And the third area that you might want to consider looking at will be the digital health uptake radar that Strahil referred to earlier. We are updating that with different evidence-based digital solutions. So you may find a digital solution in there that you think is valuable to your own region, and you may want to use that in terms of trying to identify the originator and doing the twinning with them. But the types of topics we're looking at are those tools that can support the health education and digital health literacy. It can be about the use of digital therapeutics, robotics, companion robots indeed, digital tools that can support patient feedback, supporting the proactive prevention and self-management of patients themselves and their diseases. Can be used to support home care, telemonitoring. Indeed, some of the technologies that relate into virtual consultations or telementoring or coaching, virtual coaches. I'm not going to go through the whole list, but this is just to give an example of the types of areas that would be compliant with what we're actually trying to take forward within the Digital Health Uptake project. So you can refer to this in considering the types of digital solutions you're looking for, and indeed in the documentation supporting the twinning application, you'll see the list of areas that we're particularly interested in the twinnings following. Next slide, please, Strahil. So in terms of whenever you apply for the twinning itself, the award of the twinning is going to be through a competitive twinning tender process. And the applications should therefore involve organisations from countries that are participating in the Digital Europe programme. Currently, that relates to the EU 27, Iceland, Norway and Liechtenstein. I would draw one caveat here, and colleagues may be aware, but the European Council in December 2022 laid down some restrictions on Hungary. And what I would encourage is that anyone from Hungary wanting to participate in the programme is to actually find out the current position of the European Council's decision before you actually come forward to see whether the eligibility criteria has changed or whatever on it. Whenever we sort of then start to look at what will be the focus is very much on the local, the regional, the national health and care providers in Europe that wish to adopt a digitally enabled innovative solution that is available from transfer from elsewhere in Europe. Now, in saying that, we're sort of looking to see that it will be a health and care provider with the solution is looking to transfer it to another healthcare provider in a different region or country. Within that, we would sort of encourage that if there was a company that had developed a solution, that the originator may want to take them as part of a third-party provider, so as to maybe help to explain the technology and how the technology works for the adopting region or the adopting country. But it's not a case that an SME or a company could actually lead to be the originator. They can be a third party to the originator's health and care provider. The twinning originator and the twinning adopter, it's important that they're actually from different countries, because this is where we want to use Twinnings in terms of the transfer and the scale up of the evidence-based digital health and care technology solutions across countries. So it's important that the originator and the adopters come from different countries. And an organization may participate in more than one twinning. So you're not just restricted to just picking on one, so long as the twinning solutions and the twinning activities are both significantly different. That's the caveat that we put into that. So you can apply for as many as you want, but you need to ensure the solution and the activities are significantly different between them. Next slide, please, Strahi. So when it comes to organising yourselves as the twinning partners, it's important then that the originator and the adopter or a third party comes together, and within that you would agree who is going to be the twinning contractor, because DHU, the agreement will be with the twinning contractor. And the twinning contractor could be the originator, it could be the adopter, or it could be the third party that is into the partnership as well. So that's one of the first things you need to do whenever you set up the partnership, is agree who's the twinning partner, because they will be responsible for ensuring that the application form is completed and is submitted to DHU, and the agreement, the negotiations and the discussions on the agreement will be between DHU project and the contractor. Whenever the application is submitted, it is submitted to that email address, twinnings@digitalhealthuptake.eu, and it's important that the application contains the PDF attachment, which is clearly titled so that it's easy for the evaluators to pick it up. And what we're looking for is that you put in that title, DHU twinning offer, and then whatever the short name of the twinning is that you're actually wanting to take forward. So that's all in the documentation that supports the application form. But just emphasising that point, it just makes it easier for us trying to manage the process. All the applications will go through an evaluation process, and I'll come to that shortly, in order to select the 12 twinnings that will actually take place. And if there are any questions on the whole process, they can be sent directly to twinnings@digitalhealthuptake.eu before the deadline for questions, and I'll have the timetable later on, so you'll see what time you have to ask the questions and then what time for submitting the application form itself. Next slide, please, Strahi. Okay, so we mentioned there about the twinning evaluations. The twinning evaluation will be an independent process, and every application will be measured against or assessed against the 3 criteria of excellence, impact, and implementation of the proposed twinning. So we really are looking that this isn't just a knowledge transfer event, that there is activity taking place that is looking at what needs to happen to adopt the twinning into the adopter region or the adopter regions. And the applications will be assessed against those 3 different criteria headings. And there are a number of subheadings within them. And you can see the scoring matrix that we're proposing to adopt for the twinning. It'll be a case that those twinnings that meet the minimum threshold mark will then be selected in terms of their ranking, but we will be placing a 70-30 quality price weight onto the applications as well. After the evaluation, the results will be notified to all applicants on the 2nd of October this year. Next slide, Strahil, please. Okay, this is the twinning calendar, the timeline we're working to. The Twinnings scheme was launched last week, so it is, and today is the first information webinar. We're holding our second information webinar on the 18th of July. And then by the 13th of August, if you have any questions on the Twinnings and on whatever in terms of its application, completing the application form or anything at all, you must submit those by the 13th of August. Then on the 13th of September at 5 p.m. Central European Time, that will be the deadline for submitting your Twinning application. The next stage will be our independent evaluation of the Twinnings applications, and that will take place during the second half of September with a view to the decisions being notified on the 2nd of October. And then for the remainder of October, there will be the discussions and the signing of the various Twinning contracts so that we can actually have the Twinnings commencing by the 1st of November this year, with a view that they will all be completed by the 31st of August next year. And it'll be important that whenever you're completing the Twinning on the 31st of August next year, and we will write with more details on that, we would be expecting a Twinning report coming from each Twinning, as well as the financial information reports, etc., etc. So there'll be some documentation will be needed to be completed at the end of the Twinning period as well. Next slide, or is that the last one, Strahil? Yeah, that is the last one. So that's been a sort of a walkthrough in terms of the Twinning process itself, the application, the assessment evaluation, and the timeline for it. So happy to, at this stage, hand the floor to colleagues that are participating in the webinar. We have got maybe up to 15 minutes or so to take any questions or whatever at this stage. So it's an open floor. If anybody wishes to ask a question, raise your hand or put it into the chat box or whatever.
I think there are several ways to do that. One is the chat. I saw that it's working. I hope that you can also raise a hand and we can see that, but please don't use the Q&A function because that's too many channels. I think we're a good group to be able to manage also live questions if you raise your hand or chat questions. I see that some questions are coming through the chat.
Yeah. I think the first question I see here is, do you have examples of the benefits for the originator, as in what is in it for the region that have already implemented the digital tools? When you sort of look at the impact on the patients and the service users in the originator country, probably little, but because the solution has already been tried, tested, and demonstrates its impact on that region. But in the form of the collective sharing and exchanging of solutions amongst and between each other, it's having that sense of having developed something and proven that it is useful. It's actually sharing that with another region, and that other region being able to benefit from it, so that we have a multiplication effect in terms of patients or service users across Europe. So we're actually taking that learning, taking that solution and extending it on out. Of course, there could be a commercial view to it, and that is if there was an SME that had developed the solution, maybe it provides market opportunities for them as well and bringing their solution into a new market. For health and care providers in the originator side, it's getting back further evidence as well in terms of validating what they are actually doing and the impact it is actually having on patients. Particularly where it is a digital technology, where maybe some early results coming through are showing that there is an impact, but maybe if the solution is exposed to people in another region or whatever, then it might show up different results, and that in itself can maybe help the originator health and care provider who may need to further adapt the solution that they have developed as well. So that's the sort of areas that the originators can actually benefit from. It's not sharing with others what they've actually done. It's the potential for market opportunities if there was an SME in the originator country had developed a solution, but also it's in terms of validating and maybe providing opportunities to refine or to further adapt the type of solution that's operating in the originator country. Now, not too sure if that has answered the question or not. The next question from Robert Thiessen, excuse my pronunciation. We run an innovation lab for 150 hospitals and healthcare organizations in all domains of healthcare and welfare in Amsterdam metropolitan area. We'd like to know whether there are the same kind of twin regional innovation labs in the EU and whom we can share knowledge. Is this also on the radar at the EU? Okay, there's a question I think about radar. Strahil, you might want to pick up on. The innovation lab for the 150 hospitals and healthcare organizations. Yes, there are other innovation organizations in other regions in Europe that are linked to health and care providers as well, and are looking at developing the digital solutions for those providers. Santic in France is part of the Vive Healthcare Group. So that's one example from somewhere else. But it's important, you know, as I said in the presentation, that where you are taking forward the twinning proposal, that, you know, it's important to have the health and care provider front and center within the twinning, both at the adopter side and at the originator side. Strahil, do you want to pick up on the radar, or maybe I've misinterpreted that?
I think they are asking if, whether the EU, the Commission, I guess, is also aware of these kinds of labs. And I agree with you. I think there are many, but of course, I have limited experience with this. I'm not sure. Also, innovation labs, there's living labs that I know, especially in Scandinavian countries, whether they're the same or similar. But I do think there are such labs that you can, you know, come together and either propose a twinning or just generally work on collaborating together.
Yeah. Mirella, maybe sort of bring you in. Is this on the radar of the EU, those regional innovation labs linked to the hospitals?
We have the innovation radar for all the projects, and I'm not sure for the innovation labs. You can search on our innovation radar to see if you have also find the information that you are looking for.
Yeah. Okay. Thank you very much. Agata from Lutz, how can we reach the originators who are eager to share their practices? Different ways to do that. One would be to check the radar on the DHU platform, because you will identify those digital technology solutions that are available, that are evidence-based and operating at scale within regions already. So you could make contact with any of the organizations on the radar for that purpose. The second opportunity is through your own contacts. You may know from your own contacts, meeting people from other regions at conferences, at workshops, being involved in other projects. You may sort of be aware that there is a digital solution that is available, and you make contact with them. What we would like is that through the process here, that we will sort of have a mix of originators and adopters coming forward into the whole process as well, that can actually share and reach out in order to try to identify the partners for their twinning. So those are the two key areas: the radar platform and through your own relationships with other organizations and regions across Europe as well. And sort of building on that, I see Agata has also replied to Robert, and I presume that there is a possible conversation going to take place there in terms of these laboratories, innovation labs linked to hospitals. And Agata has mentioned as well that Medical University of Lutz has 3 clinical hospitals and 1,800 test beds as well. So there's a possibility there that even today, you may start to make links with each other on what is available. The other thing that you might wish to do is that on Futurium, you can also use Futurium to maybe identify some of the digital technologies, health and care technologies that are available out there. And for those of you that are reference sites within the RSCN, if you check out some of the tabs for some of the reference sites that have uploaded their own information into our website, you may find in there some of the reference sites are talking about some of the digital solutions that they have developed and implemented as well. So that could be another source of information for you.
And also on directly where we publish on the funding and tender, I don't know if it's this case the case also for this one, but it should be. People can find themselves also through this platform. So where the call was published. So for you to know.
That's helpful. Mirella, is there anything you'd want to add, Strahil?
Yeah, I was also about to maybe suggest, of course, it depends on whether you want to share your data, but we have also as a project quite good social media outreach. So if you, for example, have a specific need and you share it with us, we can, of course, post a message on LinkedIn and other platforms we have as a project saying that you're looking for this and for people to turn to you for advice, for connecting.
Yeah, and indeed, I would sort of extend that as well, particularly for the reference sites. If you wanted to even ask us to help identify maybe an originator for you, or an originator is looking for adopters, again, we can actually facilitate that as well. So there's 2 forums there, platform and DHU, and the reference sites can use the RSCN for that too. Just trying to see, have we got any?
I just wanted to check. This is the page Mirella was talking about because it is an official call. It is also available the public and tenders portal, funding and tender portal, but I don't see that there's this box that you have also in grants where you can express a need and chat or write something. So, but yeah, there are a few other channels that we mentioned.
Mm-hmm. Mm-hmm. Just sort of reading Robert's question, supply driven from a successful practice perspective. I'm not so sure about that, Robert. It should be demand driven because the health and care provider in the originator region or country should have been defining the specification, working with industry in developing the solution, and then ensuring that the solution was developed to meet its own needs. And it's the health and care provider that is actually providing out the twinning to a health and care provider in another region. So yes, I would expect conversations have taken place, but I'd also expect that it's not just a supply driven, it's actually should be demand driven as well. But you'd actually asked the question at the end, understand the context, and is setting up such collaborations also covered in this call? What I had mentioned is that from the originator side, we're encouraging, whilst it's focusing on the health and care providers, but we're encouraging, the third-party providers to be part of the originator team coming forward. So that's where the adopter side can actually look at, what technology was used, how was it used, what adaptations had to be made to that technology, in order that it was fit for purpose for the originator's health and care provider. It's those conversations then that will take place with the twinning adopter, because they would need to understand if any changes technology had to be made, and what were those, and what was driving the demand side in making those specification for changes.
And maybe consider that what the focus is, as we said, what the focus is, but that's a soft requirement. It depends on the number and types of applications we receive. We mentioned 12 is our aim, but because of this price quality ratio, it may be, depending on the submissions, that we have more candidates or less candidates, or we might have less or more funded twinnings at the end. And you saw also the award criteria. If your twinning is still supply driven, but promises great impact and great benefits for different groups, then it will probably get a very good rating despite being supply driven. So we have to see it in the context of all applications.
I do acknowledge Robert's final point there, about the incentives for the originators. They probably are more soft incentives than the hard incentive. And I suppose whenever we sort of think of collaboration across health and care providers across Europe, it is very much about that sharing and exchange of good practices and solutions, so everybody gains from it, because everybody is broadly trying to address the same challenges. And very often we sort of can look into other regions that have addressed that challenge and learn from them. And I might offer today a solution, but maybe tomorrow someone will offer me a solution to something that I'm trying to deal with, and it's within that context. And that is one of the things that, and one of the benefits that has been driven out from the different active and healthy aging reference sites that have been working together over the last 10 years at different levels, is the benefits they see to each other in terms of that collaboration and that exchange of good practices and solutions, so that they all benefit from it as well going forward. So it is a bit soft, Robert, I would say that, but I think the fact that the reference sites have stood the test of time for 10 years would demonstrate that the regions are using those networks and the relationships with each other in order that they can benefit from what's happening right across the different regions, and collaborate and transfer that knowledge in order to address the similar health and care challenges.
It is also up to you to decide how you spend the budget. We know that usually a lot of the budget goes for the adopters, but it is really up to the twinning partners to decide how to plan and budget for that. And I really have good examples from the previous twinnings that Mirela mentioned in Digital Health Europe, where apart from image, there were also some originators who actually, because you're not thinking as a teacher while you're developing your own solution, now that you're confronted with the fact that you need to transfer this information to others, you're confronted with some questions and thoughts that you might have not come across yourself while we were doing it, and you get some new insights and you can improve your own processes. And the other thing was, again, the image, the fact that, for example, there was one originator who did 3D printing for disabled people and who had a one-to-many twinning. I think they taught 5 or 6 regions how to do it. It became the de facto kind of knowledge center for this specific area. And they're still doing it with other regions based on their experience. They were able to create almost a curriculum because they did it with several different regions. So it's been very beneficial for them as well.
I suppose is that perception of being seen as the expert by other regions across Europe raises the profile as well going forward. But those were a couple of very good examples. So there were Strahi. Are there any other questions? We've got about 2 minutes left for the webinar. Are there any other questions? Just as we may be waiting for other questions, I would encourage everyone to sort of look at the opportunities that this twinning presents for them. to identify if they have something that they would like to share with another region through the twinning, and to look establishing the twinning partners for that, to look at the different platforms to identify other digital solutions that are out there that they would be interested in taking forward, and making the contact on it, and really encourage people to get involved in this process. A lot of regions and organizations have been involved in a number of twinnings over the last number of years, and they've all found them beneficial in terms of having to address their own health and care priorities. The key dates for you going forward is another webinar will be on the 18th of July. We will have our next webinar, and then after that, if you have any questions, please post them into Twinning at DigitalHealthUptake email address by the 13th of July, and then have your submissions prepared, completed by the 13th of September. Applicants will hear on the 2nd of October the outcome of the evaluation, and then we look to have the twinning contracts all signed and completed by the end of October, with a view to starting the twinnings on the 1st of November and completing on the 31st of August next year. The maximum budget for the project is for each twinning is €8,000. And as Strahil has explained, because we're adopting the 70-30 quality funding cost ratio, that means some variations to it, but we're working with the maximum will be in and around the €8,000 for that. And whether that's a one-to-one or a one-to-many, it would be the same, unless the impact was going to have something greater over a larger number of adopter countries. We would need to look at that as well in terms of what the costs might be. Okay, if there are no other questions, I'll sort of pass to Strahil and to Mirella just to maybe make a final closing remark. Strahil, Mirella?
Just address the last comment here, that the budgets cannot stack if you have many twinnings, one-to-many twinnings. So the 8th is for one-to-one and for one-to-many. The idea being that if you have several, let's say 2 or 3, the impact is expected also to be bigger, and that will be assessed accordingly in the evaluation. So the application still has better chances, possibly, but there's no the financial incentive for adding too many adopters in one twinning.
Thanks for clarifying, Strahil. Yeah. So if Strahil and Mirella, if you want to make maybe just a brief closing comment just before we end.
Nothing from me. I hope that we were able to convey to you what the twinning is, and that you're interested. If you have any questions, there's plenty of time right now to do that, to visit the next webinar, or to submit your questions via email. And we look forward to working with Twinnings in the fall.
Okay, Mirella?
And good luck with your applications.
Short and brief. Thank you very much, everyone, for attending this afternoon. As I say, the webinar will be placed up onto the DHU website, and there will be a link from the RSCN website as well that will take you to it. Encourage you, please come forward with your twinning applications, and if you have any questions, you have to the 13th of August to submit them to the project. So thank you, and I wish everyone a pleasant afternoon. Bye.